Hi, my name is Sharon. I'm a registered nurse. I specialise in motor neuron disease and multiple sclerosis, and I also work in the general medical ward too. I've worked as an advisor with MND Queensland for the last 6 years now, and I cover the region of far north Queensland. I've been asked to speak today about, so you've been diagnosed with MND, now what? A lot of the information that I'm going to talk about often gets discussed at the first home visit rather. But as MND is a really highly variable disease amongst everybody, some of this information may be relevant to you now, it may be relevant to you in the future, and it may never be relevant for you at all. It's a very generalized talk for all variants of the disease and certainly does not replace any information that you've already received from healthcare professionals specifically involved in your care. So in this presentation, I'm going to cover about what is MND, potential causes, diagnosis process, types of MND, treatment and research, multidisciplinary care, MND Queensland, symptoms, other considerations, end-of-life care, NDIS, my aged care, and carer support, assistance and entitlements, and other links. Must apologise as well about my busy slides. There is a lot of information on them, but it's more so for later reference or reading, so try not to pay too much attention to all of the words on the screen. So what is MND? As the name suggests, it's a disease of the motor neurons. Neurons are the nerve cells that control the muscles to help us speak, breathe, move and swallow. In MND, it's the motor or the movement neurons that progressively degenerate and die. And without the nerves to activate them, the muscles gradually weaken and waste over time, leading to weakness and paralysis, swallowing difficulty, changes to speech, and then eventually respiratory failure. In this picture, you can see my pointer works. In a healthy nervous system, the signals get sent via the neurons, the upper motor neurons, from the brain to the spinal cord, and then through the lower motor neurons from the spinal cord directly to the muscle. And that's what activates the muscles to move. In MND, these signals get broken, they degenerate, they don't work as well, and sometimes the messages are lost, either in the upper motor neurons, the lower motor neurons, or both. And that means that the subsequent muscles are affected, causing weakness. This picture over here, it shows the muscles that can be affected, so the tongue and throat, arm muscles, breathing muscles, and leg muscles as well. Potential causes, so 90 to 95% of MND cases are sporadic, meaning that they appear random with no identifiable cause. 5 to 10% are familial with hereditary genetic mutations, and I've discovered quite a lot of different genetic mutations already, and I'm sure that they'll discover more in the future as well. But the familial one tends to be seen more throughout the generations. There is no known cause of MND for the sporadic variant, but there are several theoretical causes, such as environmental toxins and chemical exposure, physical trauma, viral agents, genetic susceptibility, and a variety of other things as well. So it may be one of those things just puts people over the edge. Otherwise, it could be a combination of the factors. But research is being undertaken worldwide to really try to hone in on what the causes are. Prevalence. So in MND, In 2015, it was 8.7 per 100,000, or another way to see it is one person per just over 11,400. Just over 2,000 people in Australia have MND, and males tend to be affected a little bit more so than females. And the most common age of onset is sort of between 50 to 60-year-olds. It can take a really long time to get a diagnosis, and this is often because symptoms start gradually and they're ignored or put down to something else, and then by the time you get in to see the neurologist, they have to do more investigations to make a diagnosis as well. As mentioned, it's a highly variable disease, and symptoms, progression and survival time vary significantly between individuals. You might hear that the average survival time is 2.5 years, or between 2 to 5 years. That tends to be more so for the ALS variant, which I'll discuss a bit later on as well. So how is it diagnosed? You will experience symptoms, see your GP, and then the GP does the referral to the neurologist. It can be really difficult to diagnose MND because a lot of the symptoms can be similar to other conditions. There's actually no one single test for MND, so a variety of investigations and diagnostics need to be done to eliminate other differential diagnoses before the doctor will confirm the diagnosis of MND. So what does the neurologist do? They will listen to your story, so your history, what symptoms you've experienced, and also do a physical examination. They'll do a variety of blood tests to rule out other potential conditions. One of them will be creatinine kinase, which is a test that demonstrates muscle breakdown. So in MND, the creatinine kinase level is elevated, but it's not actually a specific test for MND. It's an indicator of the disease. It could be in other conditions as well. Nerve conduction studies. So nerve function is analysed by electrically stimulating the nerves and recording the corresponding muscle activity from it. Electromyography, or EMG, is where they measure electrical activity from various muscles using a needle electrode, and muscles that have lost their nerve supply react differently to healthy muscles. MRI of the brain and spinal cord. So in MND, the MRI would appear normal because the damage of the neurons is not actually seen on MRI scans for MND. Lumbar puncture, that's where they take a sample of cerebral spinal fluid and they analyse that, doing a variety of different tests, again to rule out other conditions, and muscle biopsy as well to rule out a muscle disease. So this picture explains what different body regions are affected by upper motor neurons and lower motor neurons. So the upper motor neurons are in blue, and the lower motor neurons are in red, and the colours in between are a combination of the both. So the upper motor neurons, again, so that's the neurons from the brain down to the spinal cord. They demonstrate various symptoms such as brisk reflexes, muscle tone increased, and spasticity, whereas the lower motor neurons, that's from the spinal cord directly to the muscles, can cause absent or reduced reflexes, reduced or absent muscle tone, and fasciculations, which are the little muscle twitching that you can sometimes see in various muscle groups. So types of MND. ALS, or amyotrophic lateral sclerosis, is the most common type of MND. It involves both upper and lower motor neurons. Initial symptoms can include reduced hand grip, dragging of the feet, sometimes difficulty climbing stairs, and increased fatigue after mobilizing. And then later on, speech, swallow, and breathing muscles tend to be affected as well. The average life expectancy from onset of symptoms is about 2 to 5 years. Progressive bulbar palsy, or PBP, again, that involves the upper and lower motor neurons too. Thinking about the name bulbar palsy, so bulb refers to the base of the lower part of the brain, or the bulb region, and the nerves coming from it, and palsy meaning paralysis. So that's where you can get symptoms of slurred speech, difficulty chewing or swallowing. The voice can become weak, and also the jaw muscles and tongue muscle can become weak as well. Sometimes people can experience emotional lability, such as excessive or uncontrollable laughing or crying, and life expectancy is shorter than ALS and can be between the regions of 6 months to 3 years, but those are very, just broad numbers, like a reference range, really. Sometimes it can be more or less. Progressive muscular atrophy, so that's the lower motor neurons only being affected. Weakness is typically seen in the hands first and then spreads to the lower part of the body, which can be more severe. Muscle wasting and cramps can be experienced, clumsy hand movements, and again, the fasciculations or muscle twitching evident as well. Trunk and breathing muscles can be affected, so people's posture, and the life expectancy is actually longer than ALS, so approximately 5 to 10 years. And then if the upper motor neurons become affected, then the disease needs to be reclassified as ALS. Primary lateral sclerosis, so this is upper motor neurons only affected. It's a really rare diagnosis that is made. It affects the upper motor neurons of the arms, legs, and face muscles, and movements can become quite slow and of greater effort. But the life expectancy is significantly longer than ALS and tends to be more than 10 years. I've seen people who've had it for 20 years, but yeah, very individual. The last one I've got on there is Kennedy's disease. So this is not motor neuron disease. It is a disorder of the lower motor neurons, but it's a genetic disorder which affects males and does involve progressive weakness and wasting of the muscles as well. Drug treatment. So currently there is no treatment available that will stop or stop or reverse the progression of MND. So symptom management really is key, and particularly psychosocial support as well. There is one medication listed on the PBS or pharmaceutical benefit scheme for ALS and progressive bulbar palsy variants of MND. Riluzole comes in tablet formation, which was made available back in 2003. And then more recently, a liquid formation was made available early 2019. So some of the neurons in the brain and spinal cord release an amino acid called glutamate to communicate with other neurons. Too much glutamate tends to be released in MND, and this causes what's called glutamate excitotoxicity, and that's actually toxic to the neurons and causes them to deteriorate at a faster rate. Riluzole is an anti-glutamate medication, and it appears to block the release of glutamate from the neurons and hence can prolong neuron survival and delay that muscle degeneration occurring. It has been shown to slow down disease progression by about 6 to 19 months, and it's best taken, it's got the most benefit if taken quite soon after diagnosis. So in order to get a script for this, the neurologist does the first script where they confirm that you've got the diagnosis of ALS or PBP, as well as meeting several other criteria. And one of the criteria includes respiratory function test results, so having a forced vital capacity of greater than 60%. Ongoing scripts can just be done by your GP. The most common side effects associated with riluzole treatment is fatigue and nausea. These can be quite minor, but they can be severe also. But thankfully, they tend to resolve quite quickly after stopping the medication. It can affect liver function as well, so it shouldn't be given to people with liver issues, and regular liver function tests are recommended as well. I often speak to people about this medication. If they take it and they don't experience any side effects, that's great, continue to take it. But if you do experience side effects, it's really about thinking about quality versus quantity of life. We'll choose ALS as the most common variant, having a life expectancy of 2 to 5 years. If someone is to start taking the riluzole medication pretty soon from diagnosis and are going to survive, we'll say 2 years, if the medication slows down progression by 6 months and they survive 2.5 years, but are experiencing a lot of nausea and fatigue associated from the medication, it's not giving the person a great quality of life. So it's really thinking about how you feel and yeah, quality versus quantity, really. Yeah, it's a very individual decision. There's no right or wrong. You choose to do whatever you want to do, but just something to consider anyway. Research. So this is a topic I sort of wanted to speak a little bit more about today. There is a lot of research going on in Australia and worldwide for MND, which is really exciting. It does include different phases before coming to market, and those phases can take several years to decades to actually occur for the trials to be completed. So a lot of the trials in Australia are phase 1 and phase 2, so that's looking at smaller numbers, tens to hundreds of patients, and often looking at safety and side effects of the medication. The phase 3 trials, there are some of those about as well. It's looking, it says more so in the thousands of patients, but because in Australia, there's just over 2,000 people with MND, having a phase 3 trial with thousands of patients is not feasible. So I think the numbers are more so hundreds rather than thousands. But again, it can take years to decades for the medications to actually go through, and that's if the trials are successful. A lot of the trials are quite expensive as well, and researchers need money to do them, but thankfully there has been a lot more funding supplied to research, like through various fundraisers that you would have heard about, the Ice Bucket Challenge, and there's a variety of other things that are occurring around Australia that money gets donated to research as well. After the phase 3 trial is complete, so after a successful phase 3 trial, the medication needs to be submitted to the FDA. So an application rather needs to be submitted to the FDA. So that's the Food and Drugs administration for approval, and that's where they look at safety of the medication. From there, once it's got FDA approval, an application then needs to be submitted to the PBAC, also known as the Pharmaceutical Benefits Advisory Committee, and they analyse all the data from the clinical trials, including efficacy, long-term effects, the benefit of the drug for the patient, as well as, again, the safety and side effect profile too. If the PBAC are happy with the submission and are happy that the drug is going to work, then they approve it, which means that the government subsidise heavily the medication. And so then it becomes available and listed on the PBS, or Pharmaceutical Benefits Scheme. So depending on what entitlements you have, if you've got a healthcare card, for example, the medication may cost you $6. Otherwise, if you don't, then it would be $40 for a standard script. I'm not sure how much the standard price of Riluzole is, but I know in the field of multiple sclerosis, some of the drugs cost anywhere from $1,000 to $10,000, $12,000 for even a dose of the medication. Well, not a dose, but a course of the medication. But instead of the patient paying, tens of thousands of dollars, and depending on if they have to take it ongoing every year, it's just costing a lot less because it is PBS approved. A little bit more about research. So the location of the clinical trial is really important. Only certain hospitals are involved, and it tends to be more so the bigger hospitals, or the bigger cities such as Brisbane, Sydney, Melbourne. There'll be other ones as well, but it's more so the bigger locations. There's various inclusion and exclusion criteria, some of which will include how long you've actually had the diagnosis of MND for, what type of MND you have, if you're on Riluzole or not, and also another common one is what your respiratory function test looks like. Sometimes you need to have a certain percentage of lung function. What the outcome measures are and time commitment. So yeah, how is it going to consume up a lot of your time or not, and what they're actually looking for in the trial. So also another consideration is drug versus placebo. How many people in the trial are going to be receiving the drug? How many people are going to be receiving the placebo, so not the drug? And there's no way to find out if you would be receiving the drug or the placebo, because the way that most of the trials are done, they tend to be randomized control trials, placebo, double-blinded, so the researcher and often the patient doesn't know what the patient is receiving, just to minimize potential bias. Also consider the phase of the trial. Is it phase 1, phase 2, phase 3, how long the trial goes for as well. Is it a 6-month trial, a 12-month trial? What happens at the end of the trial? Will you continue to receive access to the drug after the trial is complete? So this website down the bottom here, it's a MND Australia website. It speaks about what the latest research is currently being undertaken and what clinical trials are currently being undertaken in Australia. And yeah, it says whereabouts the location the research is being taken, if they're actively recruiting for participants, who to contact, and a little bit more about the research itself as well. Sorry, let's have a drink. Thirsty. So ALS Quest is an online questionnaire that's run through the University of Sydney, and it's for people with or without MND to complete, and it's looking at the potential environmental factors that might play a part in MND. and that's the website for it there if you were interested in participating. The next one is the Australian MND Registry, and it's for people with MND. They collect information about the demographics, site of disease onset, the diagnosis date, any treatment you've been on, and any changes or progression with the disease over time. And again, that's Australia-based, so useful for Australia research. And again, this website down the bottom has got its MS Australia website, and it's got the latest research newsletters available on it. So if you want to receive updates, they can email you newsletters on a regular basis. MND clinics in Queensland. So unfortunately, they tend to be all in southeast Queensland, and unfortunately none in far north Queensland. But these clinics are specialised MND clinics, and the hospitals that are participating in those are listed there. So 5 of them in Queensland currently at the time of recording. The multidisciplinary care team. So healthcare this is really involving the different healthcare professionals working together to provide a collaborative and coordinated response to help improve the quality of life of the person affected with MND. So this includes the neurologist. As mentioned, the neurologist is the one that does the test to diagnose MND and rule out other potential conditions, but they also provide information about MND once a diagnosis has been made, and they initiate supportive care at appropriate times too. Physiotherapist, occupational therapist, speech pathologist, dietitian, social worker, psychologist, I'll speak about those in one of the next slides. Respiratory specialist, they specialise in the disorder of the lungs and breathing. What they do is assessments and recommend interventions that can help with breathing function. And this is including the prescription of non-invasive ventilation if suitable. GP, so they tend to be the first and primary contact for the person with MND. Initially, they recognise the symptoms that need further investigation by the neurologist and do the appropriate referral to them, but they also refer on to other healthcare professionals as well as necessary. They can provide ongoing symptom management, support, and help maintain quality of life. The orthotist, they are the ones that help with specialised splints and braces to aid mobility. Palliative care specialists help with emotional support and advanced care planning. They also help with symptom and medication management with a key focus on quality of life. And then you've got the home care and hospital nurses, residential care facilities, and MND Association advisor as well. Okay, so the physiotherapists, actually, before I speak about them, in regards to the key allied health professionals, which are on the next couple of slides, for people with MND, I'm not actually going to speak about their roles in too much depth because MND Queensland have got several webinars available uploaded on their website by these healthcare professionals, which explains their role and some advice in relation to MND a lot more extensively. And this includes some of the webinars that we've got up already include exercise manual handling, the respiratory symptom, continence, sex and intimacy, just to name a few of them. But there's always going to be more and more added on as well. And I've got that website listed at the end of my presentation. So the physiotherapists, they really focus on movement and safe mobility and transfers, as well as respiratory function, and they're also able to prescribe equipment that may help the person as well. Occupational therapists focus on adaptive measures to perform activities of daily living and improve functional abilities, and help with safe and independence and promote independence. They're also able to prescribe home modifications and any suitable aids that might be appropriate for the person. Speech pathology, so they're all to do with swallowing and communication, and again assess and educate in regards to potential modifications in regards to a safe swallow and optimal communication, and they're able to prescribe and trial different communication aids as well. A dietitian focuses on the nutritional intake and what the body's energy requirements are, and often work quite closely with a speech pathologist. The social worker does a lot really in regards to counselling, support, education, information provision in regards to social, psychological, emotional, and financial well-being. And then they can also help with medico-legal issues such as will, enduring power of attorney, and advanced health directives, etc. MND Queensland, so that's us. What do? We provide education, support and advocacy to people affected by MND, and this includes the person with MND themselves, their family, anybody else who they want us to communicate with, we absolutely can. And this is from for all phases of the disease, so from onset when the person's first diagnosed, all the way throughout the disease until end of life, and a little bit afterwards as well, just ongoing support. We provide in-service education to healthcare professionals and residential care facilities, so just helping educate people with what different care needs people with MND may have in comparison to their average client. We provide a home visit service, so instead of you coming into a hospital or a clinic to see us, we come out to your home or wherever is suitable for you and catch up with you in that environment. Sorry. We do have an occupational therapy service that's available for Southeast Queensland consumers, and also support coordination and NDIS services as well. We provide referrals to relevant services such as allied health professionals and connect people to the right services at the right time depending on what their needs are. We also have support group meetings, which you're a part of today. They are currently online due to the COVID-19 pandemic. We've got an extensive equipment pool that is available for people who access the NDIS, so we're NDIS providers, but then this equipment pool is also available to people that are not registered with the NDIS, so people through My Aged Care or people who don't access any other services at all. We also do different community and fundraising events too. Symptoms. So the symptom onset and rate of progression varies significantly with everyone with MND, and there's actually no way that we can predict the severity or the time frame. Unfortunately, the physical decline associated with MND is inevitable, and these can have really huge emotional and psychological impacts for the person, and also people, loved ones, family and friends that have to that are involved in your care and see you go through this struggle as well. Symptom management is a really huge part and really is key, and this includes multidisciplinary care team input as well as medication as well. So the symptoms can include I've got a whole list of them written here. You may experience multiple of them, you may experience all of them, you may just experience a couple. Again, it's really, really individual, but the multidisciplinary care team can help provide advice and interventions to help manage each one of these symptoms. So the muscle aches and cramps, twitches or fasciculations, clumsiness, stumbling, weakness or changes to the hands, arms, feet, legs. You'd see a physiotherapist and an occupational therapist for that. Changes to the voice, slurred speech, swallowing or chewing difficulties. Weight loss, that would be speech pathology and dietitian. Respiratory changes, again, the physiotherapist and respiratory specialist. Emotional ability, changes to behaviour and personality, they tend to be more so mild, and cognitive changes, again, various allied health professionals can help with that. And fatigue, pretty much managed by all of the healthcare professionals as well, and sometimes by improving one factor such as nutritional intake, for example, that can help with fatigue too. So you might note that I don't have any sensory symptoms listed, such as smell, touch, hearing, sight, or taste, as they don't really tend to be affected by MND usually. Other considerations, so dysphagia, that's the medical term for difficulty swallowing. If swallowing does become problematic, or you do notice any changes, then I recommend, it does require an adaptation in eating or drinking, and so that's where the speech pathologist and dietitian come in. If the swallow is exhausting or causes you fatigue or is unsafe, then the food or fluid can not go into stomach where it should, but it can actually go into your lungs and potentially cause aspiration pneumonia, which causes a whole array of other issues. So safe swallow is really, really important. A potential solution is a PEG, P-E-G, not PEG, Kiwi accent, standing for percutaneous endoscopic gastrostomy. It is a day procedure where a tube is inserted through the abdominal wall directly into the stomach, and that's a little picture just down the bottom corner here of an example of a PEG. There is a window of opportunity to have this inserted, so your respiratory function is really important. Generally, they like respiratory function to be at least 50%, but it may vary in different centres. But if it's below that, the anaesthetic risk is too great and the doctors won't insert one. It is a really individual decision, and there's no right or wrong in regards to what you want to do with PEG insertion, but really just being aware that it is an option for you. Yeah, if you were to notice changes in your breathing, they will be doing a respiratory function test anyway. So depending on what that number is, it sort of tells you how urgently you need to decide if you do or do not want to have a PEG inserted. So if it's sort of sitting at about 70 or 80%, then you know that you've still got time. If it's sitting at about 60%, you know that you need to make the decision pretty quick smart. If it's 40%, then you've unfortunately missed that window of opportunity and they won't insert the PEG. So by having a PEG, it doesn't mean that you can't eat or drink at all. That's definitely not the case. You can use the PEG for nutrition, hydration, medication. Sometimes in the early stages, people will just use it for a little water, like just a flush of water every day. Other times the thought of drinking 2 litres of water is overwhelming, particularly if you are having difficulty with your swallow. So people will have water replacement hydration through the tube, and maybe medication as well, particularly if tablets are difficult to swallow. But keeping in mind that the medication needs to be compatible with PEG tubes, so it might need to come in liquid formation instead. Not all medication can be crushed. And then nutrition, so the dietitian will be able to prescribe specific nutrition that can go through the tube. So not something that you just mix in the blender, but specific fluid that's got really good high nutritional properties associated with it. So sometimes you'll see people who will eat a normal breakfast and lunch, and then tea time comes around and quite exhausted, and sort of eating is exhausting, so might not eat. By having a PEG, you can just have a meal replacement for tea instead. Otherwise, it might be, as time goes on, using the PEG increasingly for more meals, and then just having the food that you do want to have, more so for comfort measures, you know, for the enjoyment of eating food, rather than the nutritional, having it for the nutritional intake, because you're receiving that nutrition required through the PEG feeds instead. It does help maintain weight and prolong survival by a few months, and can quite significantly improve quality of life too. Dyspnea, so that's the medical term for difficulty breathing. As I've already mentioned, respiratory muscles can become affected by MND, and it can cause feelings of breathlessness. There are different strategies to help with breathing function, and these can include positioning, saliva control, cough techniques, and room ventilation, which are all really important aspects. Chest physiotherapy is useful, but again, you don't want it to be too vigorous. You'll have respiratory function tests done, and also referral to a respiratory specialist. The respiratory specialist can prescribe non-invasive ventilation, as I've already mentioned, and they're prescribed for your individual needs and are done after a sleep study. It essentially is a machine that forces air in and out of your lungs to help with lung expansion, because when you're asleep, you're not consciously thinking about, you know, making sure that you get deep breaths. And by having adequate oxygenation overnight, just with room air, can help lift fatigue in the morning, and people can feel a little bit more energetic rather than drowsy and feeling like they've had no sleep at all. So usually people will start using the non-invasive ventilation overnight, and then as time goes on, they might need it for a couple of hours throughout the day, and then more so as the MND progresses. And it does decrease the feeling of shortness of breath. And that's a little picture of an example of the mask down the bottom. But you can get a whole array of different masks. There's some that just go on the nose. There's different straps and bands, and yeah. Advanced care planning. So just briefly speak about this. Making sure your will is up to date, making sure you've got a will. If you don't have a will, you've got to often go through, your family's often got to go through public trust, which can be rather arduous at times, and it doesn't have your needs, what you want written down there. So making sure your will is up to date. I was chatting to someone, and their will was over 20 years old, and they were leaving everything to their ex-wife, who they no longer speak to. So you don't really want that to occur. So just double checking that document. An enduring power of attorney, that's quite a short document that you can download from the internet. Otherwise, often get from newsagents as well. There's a section for health matters and a section for financial matters, and you can have an attorney for both or different attorneys for each section, depending on what you want. That's quite a simple document to do. And it's important just to note that that doesn't come in, it doesn't come into effect unless you lose capacity to make those decisions yourself. So if you're able to, have capacity and communicate your needs, it doesn't need to be verbally, it can be, just in another method. If you are able to have capacity, then the enduring power of attorney does not come into effect. It's only if you lose capacity. Statement of choices, that's quite a holistic document. It's really good. It looks at people's values and what they want. It's not something that doctors legally have to abide by, but it does provide them a lot of guidance in regards to what you want. An advanced health directive, so that's quite a long document. I think at the moment it's about 24, 26 pages. I know that they are looking at modifying the document so it comes down to maybe 12 pages and making it a little bit more user-friendly. So I think that might be coming out maybe by the end of the year, I'm not too sure. But yeah, it's another document that's worthwhile looking at, and again, available either at your newsagent or downloadable off the internet. Just make sure you've got the right Queensland version or whatever state that you're in. These websites here are quite useful, and they just sort of discuss advanced care planning a little bit further. End of life care. So again, I'm not going to speak too much about this today either, because again, MND Queensland does have an upcoming webinar about palliative care. So there's no point in doubling up on that. But essentially the end of life stages in MND can be quite sudden and difficult to control. So you need to be as prepared as best as able, and just be aware of your different options and choices and what's important to you before the time actually comes. There are different palliative care units and palliative care outreach teams available, as well as the palliative care specialists that can help you through this process. Comfort measures is really important, particularly positioning and medication. Just helps really with anxiety, agitation, restlessness, pain, nausea, those types of things, just to make the end of life process as pleasant as possible for the person. Another thing to consider is what to do with peg feeds. So often when people are at the end of life phase without a peg, they don't continue to eat orally, or if they do, it might just be a few mouthfuls. And so by having a peg in, how long is it really appropriate to continue to provide those peg feeds to the person? And yeah, but the doctor should help advise with that. But it can be a hard decision about stopping the peg feeds as well. Non-invasive ventilation is another thing to consider, as well as when to stop active treatment. But at the end of the day, it is about quality of life. Yeah. So this website down the bottom here, pallicist.org rather, is a really great resource that helps people learn a little bit more about the palliative approach and quality of life, if you did want to read more about it. The next two slides, I'm just going to speak ever so briefly about the National Disability Insurance Scheme and My Aged Care, because again, these topics have been discussed in previous MND Queensland webinars that are again available on their website. So if you do want to learn more about either one of those topics, you can see the more extensive webinars, particularly on those areas. So the NDIS website and the NDIS phone number are listed there. There is a very strict eligibility criteria, so it is for people under the age of 65. They need to be an Australian citizen or a permanent resident, or there's a couple of other citizenship eligibility things listed on the website as well. And the person must also have a permanent and significant disability. So MND does meet that criteria. And NDIS, once a package has been approved, they can help with a variety of different things, such as personal activity and transport, therapeutic supports, allied health support, aids and equipment, home modifications, mobility equipment, yeah, a whole bunch of things. It is a great service. Often people's plans get reviewed every 12 months. But with MND, you can ask for the plans to be reviewed every 6 months, just due to the quite quickly changing needs at times. And saying that people can be stable for a reasonable period, but then also due to the unpredictability, people can deteriorate quite quickly as well. My Aged Care, so again, their website and phone numbers listed there. They've got a couple of different pathways you can go through, so either the home care package or the Commonwealth Home Support Program, and again they help with personal care, allied health services, cleaning, different home modifications, assistive technology, social support, respite, that type of thing, and that's for people at least over the age of 65. If you're Aboriginal or Torres Strait Islander, I think you can, as a younger age, that you can access it from. Carer support. So it's important that we look after the carer as well. Carer is sort of a bit of a generic term that we use for the person, like often a loved one of the person with the health condition. So often husband, wife, son, daughter, any family member really, otherwise sometimes a good friend. But it's really important that they are looked after as well to help prevent carer burnout, and often that can just include respite or additional services just to help out. And by having that extra bit of support, it means that the carer is able to look after the person at home for a longer period of time. So it's a bit of a win-win by having the additional support available. In Queensland, you go through Carers Gateway. For the lower half of Queensland, it tends to be Carers Queensland, which is the provider, whereas for the northern half of Queensland is more so Wellways, and both of the websites are listed there. So other assistance and entitlements, Centrelink have got a variety of different things available, as well as taxi subsidy scheme, companion card, but our website MND Queensland right here has got a list of the different entitlements and benefits, and it includes on there how to access each entitlement, and it explains a lot more about each entitlement individually too. So some useful links and resources. So the website that I've been talking about with the different webinars on is the first one listed here. We have a lot of different information sheets uploaded to MND Queensland website as well, and that's the direct link there. MNDDecisionTools.com is a really useful tool to help people make decisions regarding motor neuron disease, such as PEGs, non-invasive ventilation, advanced care planning, end-of-life care, communication equipment, and also predictive genetic testing if they've got potentially a genetic familial form of MND. The MND Australia website. More recently, I just got an email recently about 20 videos to stream about motor neuron disease. So this is on the MND Australia website, and it's got a little bit about MND on a cellular level, a bit about research, a bit about symptoms and symptom management, but it looks quite exciting, the different videos that they've got posted there, so it's definitely worthwhile a look. And then the last website I've got is ALS Untangled. So unfortunately, as I've mentioned, there's only one drug, riluzole, licensed for MND. That there are a lot of other drugs that get spoken about, and people might try to claim that this particular treatment is a cure, and you just don't want to take something that's not going to work. So this website has got a variety of different alternative and off-label MND treatments. So you can just type in a different drug or research in the search bar, and it's got different categories there. So again, worthwhile a look if you were looking into alternative treatments. And these are my references. That's it. Any questions? So just before I do close up, if people do think of questions after this presentation is complete, the MND Queensland phone number in Brisbane, which you'll be able to speak to anybody in office hours, is 07 3372 9004. If in the future that number is disconnected, just look on our website for the new phone number, which is www.mndaq.org.au, and it will be under contact us. Yes, thank you very much.